Colorectal cancer has traditionally been seen as a disease of older adults, but a troubling trend has emerged in recent decades. More people in their 30s and 40s are being diagnosed with it, often at more advanced stages. This rise in early onset colorectal cancer has puzzled researchers and alarmed public health officials, and while several factors are likely at play, one stands out clearly: obesity. As waistlines have expanded, so too has the risk, turning excess weight into a silent, modifiable driver of one of the deadliest cancers affecting younger adults today. Obesity contributes to colorectal cancer in multiple insidious ways. It disrupts hormone regulation, fuels chronic inflammation, and drives insulin resistance, all of which create a pro-tumor environment within the gut. Fat tissue, particularly visceral fat around the abdomen, secretes inflammatory molecules and hormones like leptin and insulin-like growth factor, one that can stimulate the abnormal growth of colon cells. Over time, these changes increase the chances of mutations and decrease the body's ability to detect and eliminate abnormal cells before they become malignant. In younger adults, these metabolic disturbances may go unrecognized for years. Most people under 50 are not screened for colorectal cancer under standard guidelines, and symptoms such as fatigue, abdominal pain, or changes in bowel habits are often dismissed as stress or digestive upset, especially in those who seem too young to have cancer. This leads to delayed diagnoses, when tumors are larger, more aggressive, and more likely to have spread. Among adults under 50, obesity increases the risk of developing colorectal cancer by up to 70%, depending on the degree of excess weight. Yet this connection remains underappreciated and rarely emphasized in health messaging. The problem is compounded by lifestyle patterns that reinforce the obesity cancer link. Diets high in processed meats, refined carbohydrates, and sugary drinks, staples of the Western diet, are common among those with obesity and have been independently linked to colorectal cancer. Sedentary behavior, too, is widespread, especially in modern work environments that involve long hours of sitting with little physical movement. Together, these factors quietly accelerate disease development in younger bodies that are often assumed to be at low risk. What makes early-onset colorectal cancer especially tragic is that it is frequently more aggressive than cases diagnosed in older adults. Tumors tend to grow faster and resist treatment more stubbornly, leading to higher mortality rates even among those who receive care. And because younger individuals are less likely to have routine screenings or a high index of suspicion for cancer, they are less likely to catch it early, when intervention could still make a difference. Despite these facts, public awareness remains low. Many young adults with obesity are not counseled about their elevated cancer risk, and primary care visits often focus more on managing blood pressure or blood sugar than on discussing gastrointestinal health or long-term cancer prevention. This is a missed opportunity. Conversations about colorectal cancer should not be confined to those over 50, especially when the disease is becoming more common and more deadly in those under that threshold. Moreover, stigma continues to undermine care. Young adults with obesity may be reluctant to seek medical advice for gastrointestinal issues, fearing judgment or dismissal. When they do speak up, symptoms may be minimized or wrongly attributed to dietary habits, stress, or irritable bowel syndrome. These assumptions delay referrals, delay colonoscopies, and delay treatment, allowing the disease more time to take hold. Screening guidelines have begun to shift, with recommendations now suggesting that adults begin colorectal cancer screening at age 45 instead of 50. But even this change may not go far enough for those with significant risk factors like obesity. Earlier intervention, based not just on age, but on body mass index and metabolic health, may be necessary to identify cancers while they're still curable. Ultimately, obesity is not a cosmetic concern. It is a biological condition with serious and often fatal consequences. The rise of colorectal cancer in midlife is a stark warning, and one we cannot afford to ignore. If we continue to treat obesity as a separate issue from cancer prevention, we will miss the chance to stop this trend before it worsens. It is not enough to tell people to eat better or move more. We need a coordinated public health effort that links obesity to real outcomes, like the growing epidemic of colorectal cancer among young adults. Without that, the silent threat will continue to spread, unseen until it's too late.